So there's comment, what gives me, or vitamin D gives me anxiety when I take it. Been debating taking kids dose to see if that helps. Honestly, taking any vitamin D is probably going to help at least a little, but it may not move the needle as far as you need it to. But the reason for the anxiety, and this is part of what people don't understand, there's a large balance that needs to happen in your body between all of these things, right? And when you take vitamin D or your vitamin D gets really high, the other thing that happens is that your calcium in your blood gets really high. And that's actually what's causing the anxiety. You might be someone who I would risk using a cod liver oil supplement with, but I would start asking companies if you can get the certificate of authenticity and see what that COA says and see what the oil that you're taking has in it, because Dr. Harris said that the omegas, the cod liver oils, all of those supplements for the most part are tainted. 82% of them, in fact. Tainted can be with like petroleum. It can be, and by the way, petroleum will show up as an organic substance on a COA. So your product, even if it has petroleum in it, will still show up as completely organic because petroleum is an organic, naturally occurring resource. But it can be tainted also with things like he found in some fish oils, canola oil. So you really want to know what it is that you're taking, and a company that's not willing to release the certificate of authenticity is not a company you want to do business with. And people ask me all the time, what's the best supplement? In general, it's going to be a liposomal form of vitamin D, and for a lot of people, it's going to be a liquid. So the cod liver oil fits the bill, right? But you need it to be that you're taking it directly. It's not in a capsule. And then the other cofactors. So why does cod liver oil work? It also has vitamin A, vitamin E, and a little bit of vitamin K. You may need more vitamin K to actually help lower the calcium, because vitamin K doesn't help absorb vitamin D. It helps you drive calcium out of the blood, which is what's causing your anxiety, is too high of calcium in the blood when you take a vitamin D supplement. Other things that you can have checked that may make a difference in whether or not you're utilizing your vitamin D and able to store it are copper, magnesium, potassium, selenium, and zinc. Manganese is also one that people don't check a lot, but you can get it checked in the blood work. It's just not a test that's run often. And I think also look at the way your body processes fats. If you're someone who continually has dry skin, even if you use lotion, you're probably not absorbing your fats well, which may be an indication that you have trouble with fat soluble vitamins like A, D, E, and K. And then of course there are people who take a D vague supplement. It's not D3, and their body can't convert the other forms of D to D3, which is what your body actually needs to get rid of some of these symptoms. And unfortunately, that one's genetic. It'll also mean that you don't very well convert vitamin D from the sun. And then there's another genetic that may show that you have actually low amounts of vitamin D receptors in your body. If you have low vitamin D and low vitamin A, because they'll check those, you probably also have low vitamin E, and vitamin E is really important as an anti-inflammatory and to help healing wounds. So you'd probably want to start taking that too. And again, a liquid liposomal form is going to be your best option. But the cause for the anxiety is that the vitamin D that you're taking is driving calcium too high in your blood, and we need to get the calcium out of the blood and into the tissues where it needs to be used.